So we have an example today of something I've been talking about with you guys for a long time. One of the hallmarks of conspiratorial thinking is that finding apparent evidence is, of course, evidence of the conspiracy theory. But not finding evidence is also evidence of the conspiracy because it means that they covered up the evidence. The evidence has been destroyed. The evidence has been suppressed. And so there's really no way out of these conspiracy thinking situations. We now have an example of this from the world of COVID's conspiracies. You really have to see this. The TikTok channel The Good Liars interviewed a woman who claims that her friend, who supposedly died of COVID, which is a tragedy, was actually medically abducted and killed so that the hospital could get $50,000 for treating a fake COVID patient. This is a woman who has a friend. The friend tragically got the virus and died. That's evidence that her conspiracy about COVID being a hoax is wrong. It would seem as though the evidence disproves the COVID hoax conspiracy that this woman believes. Nope. The fact that her friend died of COVID becomes part of the conspiracy. The evidence was faked. She was abducted. Her friend didn't really die of COVID. So let's look at the full clip once, then we're going to look back at some individual pieces because there's just so much here.
Another friend of mine, she actually was medically kidnapped. They did it to get the money for $50,000 because if you say you have COVID, you get $50,000 to hospitals.
But she died of COVID in the hospital?
She didn't die of COVID. They killed her.
But she tested positive for COVID?
No, she just passed out because she was weak this one day. I have a picture of her. They have her mouth, they have her sedated, they have her on that ventilator.
Okay, so of course this is all horribly tragic. A death from COVID is tragic, but also this woman believing that this is what happened is tragic as well. So let's dig into just how much stuff is wrong about what she says, because it's actually remarkable how much is squeezed into just 21 seconds here. Let's look at the first bit again.
Another friend of mine, she actually was medically kidnapped. They did it to get the money for $50,000 because if you say you have COVID, you get $50,000 to hospital.
Okay, so there's this idea. If a hospital says someone has COVID, they get $50,000 for treating them. This all goes back to when Medicare rates were established for COVID-19 patients who don't need to be put on a ventilator and who do need to be put on a ventilator, it turned out that the reimbursement rates for Medicare patients were a little bit higher than for non-COVID hospitalizations. There's a reason for that, and there's also no evidence whatsoever of fraudulent reporting. And the other funny thing is, the numbers started at 35,000 for COVID patients. Now that apparently wasn't wacky enough. So now they go to, it's 50,000 for a COVID patient. Medicare establishes reimbursement rates for treatment. It is true that if a patient goes on a ventilator, Medicare reimburses more than if they don't because they're providing more services. It is true that for COVID patients on ventilators, Medicare reimburses a little bit more because remember, the way health insurance works is on average, it is more expensive to treat the COVID patient that is on a ventilator. Now, we can have an argument about how our medical system works, how it works where doctors and hospitals get paid for each thing that they do rather than simply for keeping people healthy or making people healthy. That's all fine. But the issue here is hospitals don't just get cash for claiming people have COVID, and there is no evidence whatsoever that hospitals are lying about it. There is no evidence hospitals are lying about it. They are simply being compensated based on the services that they provide. This is really nutty stuff. Let's look at the rest of it.
But she died of COVID in the hospital?
She didn't die of COVID. They killed her.
But she tested positive for COVID?
No, she just passed out because she was weak this one day. I have a picture of her. They have her mouth, they have her sedated, they have her on that ventilator.
Imagine that story. Her friend was fine. And then one day her friend passes out because she was weak that day. It was just a weak day. The friend passed out. Nothing was wrong with her, just a weak day. And in swoops a hospital, abducts her, reports her as having COVID to get the $50K, and then kills her. And this brings me to one other aspect of this that's really, really wild. You don't need the patient to die to get paid. If you treat them at the hospital, you get paid for the treatment you provide. You don't get more money because they die. And the conspiracy theorists would say, well, no, David, please, The reason you have to kill them is because otherwise they could go and say, I didn't really have COVID, they kidnapped me or whatever. But now there's a new conspiracy, right? You're adding layers of complexity to the conspiracy. That was another wacky part of it. This is serious illness. I'm talking about what the woman that survived has. That is serious illness. And unfortunately, how on earth do you talk sense into someone like that? You know, there are some conspiracy theorists that when you talk to them, you sort of get the feeling maybe I'd be able to talk some sense into them. We might be able to have like a real conversation, and over time they might be able to be disabused and deprogrammed of these beliefs. I don't know how you could with this woman. I really don't. And of course, the idea of hospitals overcounting for cash happens to be something Trump floated in 2020. Trump talked about hospitals are lying about this to make money. So there's always some Trump connection, and certainly I would assume that this woman voted for Donald Trump. This is really bad stuff. This is, to call it weaponized delusions, I don't think goes far enough. And I don't know how we deal with that. If you have any ideas, let me know. If your job requires you to know what people are talking about online, or you're just curious what's being discussed online, check out Thought Leaders, which has an awesome data platform that scrapes through YouTube, podcasts, newsletters every day and analyzes what is in the content. And then they turn that data into customizable graphs, whether that's a brand, a person, a topic, anything else you want to explore. Companies can see where their competitors have been mentioned. Marketers can see what trends are on the rise before planning strategy. Or content creators like me can see what topics and themes are being featured on other shows. For example, you can see here, I can track what podcasts are discussing the midterm elections, or I can see how many YouTube channels are talking about Rudy Giuliani. Or I can even see what shows have mentioned me by searching my own name. And you can use this for free. That's free forever. Sign up today. Create your own instant Thought Leaders Trends report now. The link is down below.